Well, I think we never had any idea when we began that hospice was going to be the large organization that it is. It really is one of the largest in the United States.
It was the first hospice in this entire region. And before hospice came around, nobody knew what palliative care was. It didn't exist.
Trying to get things together and try to build a plane in flight. We used to say that many times. We were building a plane in flight because when we first started, nobody knew what hospice was. No one even knew how to pronounce the word. I remember going into a shotgun home one night and I introduced myself and this man yells, "Mom, the hostage nurse is here." So we had a lot of miscommunication about who we were, but the bottom line was we were there to help, and that was what they wanted.
When I first came, very few people really knew what hospice was, had to really convince them. Now most people have had a hospice experience, so to know us is to love us. That's probably the biggest change I see.
For me, I can't believe it. Because I was there at the beginning. 40 years have gone by.
When we started, we made things up. There was no guide. We just started and did it. And luckily, we had a lot of great people.
I was one of the founders of hospice, so I've been involved for 42 years.
I was a chaplain and spiritual care and pastoral care. For every patient, there was a physician assigned, there was a nurse, there was a social worker, chaplain, volunteer, and we would meet at least once a week.
I first got involved with Hospice about 14 and a half years ago. I wanted to give back to them for everything that they've given to us.
I worked for hospice for 34 years. I was their first hired nurse and was a volunteer nurse. I worked in intensive care at Jewish in the late 70s, and I saw people dying, but nobody was helping them.
The first hospice in the world was in 1975, so we were very early in it. And most people responded questionably. They had never heard of it. They were leery of it.
Knowing that you gave people choices and gave them back a little bit of control in their lives when they thought they had no control was very rewarding.
I think it meant a lot in those days because we were essentially giving away care that people needed and didn't even know about.
So what's been very pleasing to me is to see that hospice hasn't compromised any of that.
Yeah, I think the thing that we work hardest at is to make sure that the culture stays the same.
You know, I think that the care that's provided is very much the same in that you're trying to meet a person's needs.
And this year will help close to 8,000. And so everyone that's been part of this history has helped us build up to helping that many. But the most important thing is that we do whatever it takes to make sure that that family gets support.
I think the future is very bright. It's been a great 40 years, but we've come a long way from a small community-based organization to really a key player in the healthcare marketplace in the greater Louisville area.
Yeah, I mean, it's amazing that it's been going on for 40 years, and it feels like they've always been there, because in my lifetime they have. It's so important, and I can't imagine if living in a community where we didn't have these resources and we didn't have these people that are just so incredibly compassionate, that literally work every day just to make sure somebody's comfortable, just to make sure the family's comfortable.
I often tell people I do the three things that people fear the most: public speaking, fundraising, and working with death and dying. But I'm called to do that. It's a ministry. It's way beyond a job.
I have told people for years, I think I've helped more people die than I've helped to live. It has been such an honor to be able to take care of these patients and their families.
I do it because that's what I was supposed to do.
I think that the impact that Hospice makes in this community is vast, but I think we can make an even greater impact. And the only way we're going to do that, though, is by more people getting involved, by more people donating, volunteering, working.
As a fundraiser, I can't think of anything better to raise money for, because we deal with life and death itself. After you've done hospice, there's just nothing else that can compare. We try to make the end of life the best chapter of life. We try to make it, a real living process, even to the very, very end.
Congratulations, Hosparus Health, on 40 years of serving our community.
40 years of compassionate care.
40 years of making a difference.
40 years of commitment.
Congratulations, Hospice Health, on 40 years of service, and I wish you another 40.